Have you seen this or maybe days before? Yes, that is jaundice, the yellowish discoloration of the skin and the mucous membrane. Sadly, that is what some quacks will see and immediately conclude that, oh, you have hepatitis, and then begin unnecessary and harmful treatment. Yes, hepatitis can cause jaundice, but there are other various causes of jaundice, and knowing the exact cause is key to giving the right treatment. In fact, only a gastroenterologist is officially licensed to manage hepatitis. Even when I become a consultant family physician, I am not authorized to manage hepatitis. So please be careful out there. Don't let anybody play guesswork with your life. Welcome back to my channel. This is Dr. Adebowale. Now, here is something else most people don't know. Jaundice can affect newborns. It might seem mild, but some cases it can lead to brain damage and even death if not treated on time. So in this video, I'll be taking you through the cause of jaundice in newborn, the signs to look out for, the complications, how to prevent it, and what to do when you see it. Later on, we'll talk about jaundice in older children and adults. So I'm going to take you through it one step at a time so that you understand it, you'll be able to use it and help others around you. First of all, let me tell you a real life story. A newborn baby, perfectly fine at birth, suddenly stopped sucking just a day to his naming ceremony. A kind visitor who noticed the baby yellow body begged the parents to rush him to the hospital, but the parents refused and said, oh, the naming ceremony must hold with the hope that the next day they are going to present to the hospital. The grandmother also dismissed the warning and gave the baby herbal concussion instead. I don't blame her, it's because that is what she knows about jaundice. And by the time they finally present to the hospital, it was too late. He has a very low blood sugar and the jaundice has already entered into the brain. Sadly, the baby died while we are trying to resuscitate him. Now, the question is, why ignore the warning sign? Why delay life-saving care? Why give herbal concussion? Most people don't know, which is very sad. This is one of the many stories we see in the hospital. Now, how can you recognize jaundice in newborn? Remember in my intro, I said jaundice is the yellowish discoloration of the skin and the white part of the eye. Ideally, a healthy baby should be pink all over. The face, the belly, the hands, everywhere has to be pink. If your baby looks yellow, especially on the skin, or you check the eye and you notice it is yellow, be alert. Check your baby under natural light. For example, you can take the baby to the window side during the day and you check the white part of the eye. You see whether it is yellow. You can also gently press the forehead or the chest just for 2 seconds. If you notice that it is yellow instead of white, that is a sign. You can also tap their feet lightly to make them to cry, and in the process of crying they are likely to squeeze if the eyebrow area here looks yellow. So please, I beg you, don't wait, check early and act fast. If you are not sure, don't guess, go to the hospital. A simple bilirubin test will even help to confirm the diagnosis. Remember, early action saves lives. Let's stop losing our babies to what can be prevented. Let's talk about the causes of jaundice in newborn, also known as neonatal jaundice. There are several causes of them. Some are congenital, that is, they are acquired from birth, while others are due to environmental causes. So jaundice happens when there are too much of bilirubin in the baby's body. Bilirubin is a yellow waste product from breakdown of red blood cells. So normally the liver will try to process it and then remove the bilirubin from the body. But when the balance between the production and the excretion is disturbed, jaundice will occur. There are 3 major mechanisms behind this jaundice. Number 1 is overproduction of bilirubin. This happens when the red blood cells are breaking down faster than normal. Example occur in blood incompatibility between the mother and the child, meaning the blood group of the mother and the child are not compatible. This usually occur when the mother is blood group O and the baby is either A or B or AB. It's become even worse when the mother is resource negative and the child is resource positive. Another example is when the baby has a disease called G6PD deficiency or other red cell defect. It can also occur in baby who has bad trauma like cephalhematoma hematoma like this. Infection during the early stage of life can also predispose a child to having rapid breakdown of red blood cells. Reason why where you deliver is important, and also your hygiene and that of the baby needs to be taken very serious. Some cultural practices can also cause this, like the use of camphor, usually used to prevent cockroaches at home, and they are usually put inside clothes, or when the baby is being exposed to methylated powder, can also predispose the child to having rapid breakdown of red cells. Number two mechanism is when the liver is malfunctioning. In number one, we said the red cells are breaking down faster than the liver can clear. In the second cause, the liver is a problem. So any disease of the liver like hepatitis or congenital disease like Gilbert syndrome, so the liver will be unable to process the bilirubin properly. The third mechanism is when there is blockage of excretion. Remember, bilirubin is a waste product, so it must be passed out. After being metabolized by the liver, it is passed into the gallbladder. From the gallbladder, it is passed into the intestine, where it is passed out with feces. Some can also get reabsorbed by the body and passed out with urine. So blockage in any of these routes is a problem. Example occur in biliary atresia and intestinal obstruction. So what does this mean for you as a parent? You cannot use herbal concoction to treat jaundice in babies, especially when the cause is a structural cause. Rather, it will even make things to become worse. So always take your baby to the hospital, because only a proper medical test can reveal the true cause. Now let's talk about how jaundice is being treated in newborns. I know many parents would love to hear a quick remedy they can try at home, but unfortunately there are no safe home remedies for jaundice in baby. The right step for you to take is to take the baby to the hospital immediately. This is because the doctor will need to evaluate your child, to do physical examination, and also ask you some questions. Investigation also needs to be performed so as to determine the level of serum bilirubin and also to determine the cause of the jaundice. So only then can the best treatment option be chosen. But I would like to talk about four major treatment options used in hospitals depending on the cause. Now, number one is phototherapy. This is the most common treatment. The baby is placed under a special blue light. Remember, not a sunlight. The light will help to break down bilirubin in the skin so that it will be excreted easily. Certain precautions like covering of the baby's eyes to prevent damage, and also the diaper region needs to be taken. The duration and the intensity of the light will also need to be monitored. So please don't try sunlight exposure at home, because it is ineffective and can cause sunburn and dehydration. Number two is exchange blood transfusion. This is used in severe cases when the bilirubin is dangerously high. In this procedure, small amounts of the baby's blood are gradually removed and replaced with a compatible donor's blood. The purpose is to remove bilirubin-rich red blood cells. It is delicate but life-saving procedure done in special care units. And the third one is the use of intravenous immunoglobulins. This is an injection, and whenever you hear about immunoglobulins, it is usually very expensive. So this is used in baby with blood group incompatibility. For example, when the baby blood group is reacting with that of the mother. So immunoglobulins will help to reduce the breakdown of red blood cells and help to control the jaundice. And the last but not the least is surgery. So if the jaundice is caused by blockage in the bile duct, e.g. in biliary atresia, then surgery may be required to correct the abnormality and allow the bilirubin to flow out properly. So the takeaway message here is that there is no one size fits all treatment. Each baby is unique and must be accessed medically. So once you suspect your baby has jaundice, do not delay. Take them to the hospital immediately, because your life baby may depend on it. Now let's talk about the serious complications of untreated jaundice in babies, and more importantly, how to prevent them. Jaundice in newborn is common, but when it's not recognized early or treated on time, it can become very dangerous. And I said this not to scare you, but because I genuinely don't want any family to spend their hard-earned money, time, and emotions on a preventable health issue. So what happens when jaundice is not treated early? If a baby with jaundice is left untreated, especially when bilirubin level becomes too high, several life-threatening complications can develop. For example, seizure. And during such seizure, baby can aspirate, and this can lead to breathing difficulty or pneumonia. Some can develop seizure throughout their life. Number two is refusal to suck. A jaundice baby may stop feeding well, which leads to low blood sugar level. And trust me, that one even kills faster than the jaundice. Number three, they can develop kernicterus, and this is a type of brain damage caused by very high bilirubin level. It is irreversible and can lead to cerebral palsy, hearing loss, intellectual disability, movement and speech disorders, and many other things just because treatment was delayed. So how do we prevent this? The good news is that jaundice can be prevented or managed early with simple steps. Number one is that deliver in a licensed health facility. I don't know how to overemphasize this because there are so many health centers that are not licensed. So please ensure you deliver in a registered hospital or clinic with a trained healthcare professionals, because they will be trained to detect early signs of jaundice before even you notice it. Number two is that you have to be observant at home. Learn what jaundice look like, the yellowing of the skin and the eye. You use natural light like your window side to check your baby's skin regularly, especially the first 7 days of life. Three, don't delay hospital visits. If you suspect that something is off, please kindly present to the hospital immediately. And if you are requested to do serum bilirubin before you are being discharged home after delivery, your doctor may actually suggest it. Please do not decline. I know sometimes you might feel that, oh, they are trying to find something to keep you in the hospital. We just want your baby to go home healthy and not return as an emergency. There are real life stories where doctors have counseled mother to do serum bilirubin before going home, but they declined and eventually have to land in the hospital a few days after discharge. I believe with this video you've been able to learn one or two things. I want you to share this with new moms and new dads and anybody you think might benefit from this, and I will see you in my next video. Bye.